So the KEYNOTE-040 study was a randomized phase 3 study conducted in patients with relapsed metastatic head and neck cancer whose disease had progressed on prior platinum therapy. A total of 495 patients were recruited to this study, and they were treated with one of two therapy approaches. The first was the experimental arm that was Pembrolizumab, delivered as a dose of 200 milligrams every 3 weeks. And the other treatment was investigator's choice standard of care chemotherapy, in which the investigator could choose one of 3 different regimens. Either single agent docetaxel, given at a dose of 75 milligrams per meter squared every 3 weeks, methotrexate, given at a dose of 40 milligrams per meter squared every week, with the possibility of escalating that dose to 60 milligrams per meter squared if the treatment was tolerable. And the third regimen was single-agent cetuximab, initially given as a loading dose of 400 milligrams per meter squared, and then as maintenance doses of 250 milligrams per meter squared every week. So the results of this study confirmed a clinically meaningful benefit of pembrolizumab over standard of care investigator choice chemotherapy. There was an improvement in median overall survival, with the pembrolizumab arm having a median overall survival of 8.4 months versus 6.9 months for the investigator choice standard of care chemotherapy. These data indicate a clinical benefit for pembrolizumab over standard of care chemotherapy in this population. The landmark analysis at 1 year demonstrated again an improvement in favor of pembrolizumab, with approximately 37% of patients alive at 1 year on pembrolizumab, compared with something like 27% of patients receiving standard of care chemotherapy. There was also a significant difference in the toxicity profile between the two regimens. So when looking at grade 3 treatment-related toxicities, approximately 15% of patients receiving pembrolizumab had such toxicities, but that value was significantly higher in the patients receiving standard of care chemotherapy at approximately 36%, again indicating a benefit in favor of pembrolizumab. We also present data on patient-reported outcomes and quality of life measures at this Congress, and we demonstrate that the group of patients receiving pembrolizumab had a significant improvement in their global health status quality of life scores as measured by the EORTC QLQ-C30 questionnaire, again indicating a strong benefit in favor of the use of pembrolizumab in this group of patients.